Hi everyone, let's quickly do the examination of hypoglossal nerve, which is the 12th cranial nerve, and this is the easiest because this supplies the muscles of the tongue. Very important. Now, hypoglossal nerve, its nucleus is situated close to the midline immediately beneath the floor of the lower part of the fourth ventricle. The hypoglossal nerve emerges on the interior surface of medulla and leaves the skull through the hypoglossal canal. So jugular foramen was for accessory nerve. Hypoglossal canal is for the hypoglossal nerve. Easy. The hypoglossal nerve supplies the intrinsic muscles of the tongue, the styloglossus, hyoglossus, genioglossus. It is purely motor nerve. It's a completely motor nerve. This is very simple. It supplies the intrinsic muscles of the tongue. Not just intrinsic, some books also say that it supplies both extrinsic as well as the intrinsic muscles of the tongue. Now you may be getting slightly confused between the muscles of the tongue. So yeah, tongue has two pair of muscles. It's extrinsic muscles and intrinsic muscles. The intrinsic muscles are longitudinal, superior longitudinal, inferior longitudinal, then you have the vertical, and then you have the transverse. So vertical, transverse, superior longitudinal, inferior longitudinal, easy. Superior longitudinal, inferior longitudinal, then you have transverse and vertical. These are intrinsic muscles. Then you have the extrinsic muscles. You have flatoglossus, styloglossus, hyoglossus, genioglossus. Now, it's very important to note that styloglossus, then what are the muscles? Styloglossus, hyoglossus, and genioglossus. These three are supplied by your hypoglossal nerve and obviously all the intrinsic muscles as well, and these three. But the platoglossus muscle, it is not supplied by the hypoglossal nerve. So very important. So again, what do we have? We have all of these muscles of the tongue. Platoglossus, then you have styloglossus. So styloglossus from styloid to the tongue, styloglossus. Then you have hyoglossus, which is from the hyoid bone. This is the hyoid bone right here. So hyoid bone to the tongue, hyoglossus. You have styloglossus, hyoglossus. Then you have the genioglossus from the mouth of the tongue, and then you have your platoglossus, right? So platoglossus is somewhere close to the palate, so it comes like from the palate, right? It's not shown in this. So again, genioglossus, styloglossus, hyoglossus, and then platoglossus, the four muscles of the tongue. So except the platoglossus, the remaining styloglossus, the hyoglossus, genioglossus, they're supplied by the hypoglossal nerve as well as the intrinsic muscles. So intrinsic, not some books, basically, obviously, everyone says that intrinsic muscles as well as a few extrinsic muscles. So these three extrinsic muscles, right? So yeah, now to test the integrity of the nerve, the patient is asked, first of all, you have to obviously go through the entire examination protocol of making sure your hands are sanitized. You have to approach to the right side, you have to introduce yourself and explain the procedure, reassure them that they're not going to experience any sort of pain, and then you're going to take their consent. In order to test the integrity of the nerve, first of all, the patient is asked to put out the tongue. So you have to ask them to protrude their tongue. If there is a lower motor neuron type of lesion, the tongue will be observed to deviate toward the paralyzed side. So in facial nerve palsy, we told you that the smile will become lopsided and it will deviate towards the healthy side. Here, the tongue is going to deviate towards the paralyzed side. So it's basically ipsilateral nerve innervation. The tongue will be smaller on the side of the lesion owing to muscle atrophy. There'll be obviously muscle atrophy. So the side of the lesion, the tongue will be smaller. There'll be fasciculation also. They could be potentially be present. They may accompany or precede the atrophy. Then you have to ask the patient to move the tongue from side to side. Check the power of the tongue by asking the patient to press the tongue inside the cheek while you press from outside. So there are three tests, very basic, right? So what are the tests? Again, first of all, in order to test the integrity, just ask the patient to protrude their tongue. If they're able to protrude it, well and good. If it deviates towards the weakened side, towards the paralyzed side, it means there'll be lesion of the hypoglossal nerve, right? That's one thing. You could also observe atrophy or fasciculation. So put out the tongue. So once they put out the tongue, if they're able to do it properly, and then we'll observe the atrophy and fasciculation, nothing there, well and good. Then you have to ask them to move their tongue uh, from side to side, and then you have to ask them to, in order to check the power, ask them to press the inside of the cheek, right? Press the tongue inside of the cheek, and then you have to uh, sort of press from outside. So this way you'll check the power. So this is so simple. Hypoglossal nerve. Here also you can see what are the muscles which are supplied by your hypoglossal nerve. So intrinsic muscle of the tongue, then your genioglossus, then you have the hyoglossus, and then you have the styloglossus. Where's the styloglossus? This is the styloglossus, right? So where did they label the muscle? I don't know where they label the muscle. Styloglossus is, yeah, here. See, styloglossus. Sorry, here. Yeah. styloglossus, genoglossus, and hyoglossus. So that's it. This is examination of the hypoglossal nerve.